So I'd like to welcome all of you on another very informative and amazing session on Shiksha. I am Bhagyashree, your moderator for this session today. And of course, we know topic for today's session is all about Masters in Public Health course, which is by Jindal School of Public Health and Human Development. And today we have a very eminent panelist with us here, who is here to share all that information and so much of knowledge and experience. So let me extend my warm welcome to Dr. Stephen P. Marks, Dean from Jindal School of Public Health and Human Development. Sir, thank you so very much for taking out time and being with us on this session, and a very, very warm welcome to you on Shiksha's platform.
Thank you very much indeed. It is my great pleasure to be able to share with you some thoughts about what this Masters in Public Health is all about. In order to do so, if I may, I'd like to share the screen.
Sure, sir.
So this webinar is about the MPH, and the overarching theme is the scope and opportunities for this MPH program. The circular that was shared with the people who are participating in this webinar enumerated the following 5 items, topics that we were going to discuss. And we will discuss all of those items, but if you'll bear with me, I'm going to ask Vivekanand Jha to address items 2 and 3 after I've addressed items 1, 4, and 5. So that is the way we're going to proceed. And to introduce the topic, if I may, I want to start by stating something that I'm sure everybody attending here already has foremost in their thoughts, which is the pandemic has certainly brought to our attention the extraordinary importance of public health and the strengths and weaknesses of public health. What would professional training in public health do to improve the response to health events like the pandemic that we are still living through? And as a way of introducing the subject and the urgency for having a Master's in Public Health, let me suggest a few of the challenges that were revealed by and continue to be revealed by COVID-19 and the pandemic. Obviously, the first one is pandemic preparedness. Was there adequate training, facilities, monitoring to anticipate what was coming, the ampler of what was coming, and what to do about it? People trained in public health should be able to improve that. The statistical measurement to know what is happening at what scale. How do we count? Those are skills that are acquired in public health. Prevention, obviously, development of vaccinations, travel restrictions, lockdowns, efforts to prevent people from contracting the disease. Those are matters that public health professionals are engaged in. Treatment, hospitalization, access to oxygen, personal protective equipment. All of those are areas where you need people trained in public health to provide the necessary skills to address the questions head on. Another issue that you might not have thought about is that we found during this pandemic that there have been restrictions on freedom of expression. People have been prevented from assembling, including to worship. People have, of course, been denied freedom of movement, access to education, access to work. These constitute human rights violations. How do we address those? How does human rights figure into training in public health to be able to be more effective the next time we have to address a major epidemic of this type and other public health emergencies that arise? The pandemic has brought out social, economic, and racial disparities, prejudices, anti-phobia, and xenophobia, and various forms of racism and caste expression. These areas are also matters that people in public health need to address. And finally, COVID-19 has brought out the dangers from misinformation and hesitancy, the need for addressing digital health, that is the utilization of the social media in ways that are positive for achieving public health outcomes and do not contribute to the problem. So that suggests the urgency of more training in public health. And to give you just one example, it has recently been pointed out publicly that the World Health Organization has argued that India undercounted the death toll from COVID-19 by 10 times. That's colossal, that's enormous. And of course, the Indian government has challenged that and objected to the use of the mathematical models for projecting excess mortality estimates. And so here we have, on that scale of 10 times undercounting is the allegation that is made. What are the tools necessary? What would somebody trained in public health say we need to do to be able to understand how to count? And this, I apologize for this rather detailed slide, but it addresses the 8 core issues of achieving universal health coverage in India. If you have these ideas in mind, you will realize the urgency and the value of training in public health. How do we reach the most deprived populations? How do we address questions of employment, income, food security, water and sanitation? What are the skills in encouraging health-seeking behaviors on the part of the population? How do we improve the expenditure on health to achieve an adequate rate of public health expenditure to meet the public health goals? Healthcare delivery system, public-private partnerships, human resources, all of these issues, and of course, sustained intensive health education. These are all areas that have been identified for decades as being necessary to achieve universal health coverage in India. How do we get there? We get there by understanding public health. And this is what I'm going to do in the time remaining to me, is to share with you how public health is defined and how human development is defined. The interdisciplinary nature of public health, the methods we use in public health, the core competencies and the curriculum that we have, and the career prospects. Who is going to employ you once you have an MPH? And then I will turn it over to Vivekanand, who will discuss the process of enrolling. So let me introduce some definitional components. It may seem obvious to many people what public health means, maybe less obvious what human development means, but let me draw your attention to the fact that at the end of, in the late 19th century and early 20th century, medical practitioners were beginning to understand that medicine is not merely a matter of doctors providing cures and treatment to their patients. It involved a social dimension, social medicine. And these were some of the founders of the concept of social medicine that evolved into what the World Health Organization, in its constitution, which was adopted in 1946, defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Think about that for a moment. Public health is more than curing disease and addressing infirmities. Public health involves the complete state of physical, mental, and social well-being. How do we train professionals to be able to make that part of the lived reality of people? So public health has a definition. It focuses on the health of populations rather than on individual patients. It has been defined as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society organizations, public and private, communities, and individuals. So that's what it's all about, is addressing at the population level health. And one of the ways of getting a better understanding of what public health is really all about is to look at the building blocks of public health systems. Every nation has to have a public health system. In order to be functioning, the public health system has to obviously provide health service delivery, but it needs a health workforce. It needs an information system. It needs access to essential medicines. It needs health financing. It needs leadership and governance. These are the 6 building blocks of health systems. And people trained in public health and a master's in public health acquire these skills so that they can contribute to improving the public health system. Now, this school is called the Jindal School of Public Health and Human Development. Why human development? Let's reflect for a moment. on what human development really means. Human development is about much more than the rise and fall of national incomes. It is an understanding of development that seeks to allow people to develop their full potential. As the United Nations Human Development Report, in its first report on human development, stated, economic growth is a means and not an end to development. Think about that for a moment. People are keenly interested in GDP growth. What is our percentage of GDP growth? How much has growth occurred in our country? That's not how people's lives are made better. That's a component element. It's important, but it's a means, not an end. What is the end? The end is human development. That is, allowing people to have the capacities to develop their full potential and lead productive and creative lives in accordance with their needs and interests. So that's really what we're combining in this master's degree, is the understanding of those component elements of public health along with achieving human development. The colleague of mine, Amartya Sen, has been a leader in defining human development, as you can see from his definition here, and he has played a major role in transforming the approach taken by the United Nations Development Program in measuring human development, not growth being merely a means, but human development as an approach that improves people's lives, the richness of people's lives. And he attributes a lot of the responsibility for this conceptualization to Mahbub al-Haq, the former Minister of Finance of Pakistan. And so it's an interesting combination of a leading Indian Nobel Prize winner along with Pakistani head of the Human Development Program of the United Nations Development Program that gave us this conceptualization. Now, as we teach public health in schools of public health across the world, we're immediately introduced to the interdisciplinary nature of it. Of course, you can expect that if you're going to study public health, you're going to need people with a background in biology and medicine and epidemiology and biostatistics, nutrition, bioethics, demography, and economics, health economics. That's what you expect. But you know, a surprising thing that you will learn if you take a master's in public health is that there are other disciplines that feed into the understanding, the full understanding of how to achieve public health in the context of human development. And it involves people with a background in history and political science and law and anthropology and human rights and humanitarian studies and philosophy and sociology, development studies, and so on. So that's the richness of the intellectual content. The methods involve empirical methods, where we develop an understanding of what's going on in the world by conducting trials and field studies and randomized controlled trials. But it also involves more deductive reasoning, policy analysis, human rights research, global health governance, public health ethics, study of inequalities, and so on. So these are the methods and approaches that enrich the field of public health and that are part of the study of public health for the master's degree that we're offering here. And I'll quickly allude to the fact that as we try to train people in the master's in public health, we have a list of competencies that have been defined by the Council on Education for Public Health. I don't have time to go into them now. I'll simply draw your attention to this considerable list of competencies that relate to evidence-based approaches to health, to planning and management, to training and leadership and communications, and so on. So that's a very rich array of specific skills, and each session of each class that you will take will be aiming at giving you those particular skills. And let's take a quick look at the program of this master's degree in public health. We, in year one, will start out by having courses dealing with principles and history of public health, core concepts of biostatistics and epidemiology, methods, law, ethics, human rights, social and behavior and structural determinants of health. These sorts of issues will be covered in the first semester. And we branch out from there to global health and health systems management and health and introduction to health economics and those sorts of issues in year one. And these will all include, of course, field immersion and opportunities for you to spend time in a location where these principles that you learn in class are put into practice. And in year two, we go deeper into these subject areas where we can deal with reproductive and maternal and child and adolescent health and environmental and occupational health and so on. And you have an opportunity to write a thesis and to take electives from the wide range of offerings across the 11 other schools at O P Jindal Global University. And of course, you'll have a mandatory internship in global health policy as we get to the final semester, and you have an opportunity for electives that will give you an opportunity to specialize in cross-registered areas and take full advantage, as I was saying earlier, of the offerings across this university. And my final point, before I turn the floor over to my colleague, is that the essence of what this is all about, of why we learn public health, of why we offer a master's in public health, is to bridge what we call the no-do gap. In other words, strengthening national health systems. There's a wonderful organization called the Lancet Citizens Commission on Reimagining India's Health System that has identified the challenges here. Global health governance is another area where we bridge that no-do gap. We have the knowledge that you acquire in your master's degree in public health, and you in dealing with such issues as tobacco control and humanitarian relief and public health emergencies, humanitarian assistance and relief, mobilization of civil society organizations. These are all locations where the no-do gap is bridged. And so my concluding observation is this quotation from the World Health Organization on the knowledge transition in global health. I think if you reflect on this sentence, you will realize the urgency of pursuing a master's in public health. Knowledge derived from research and experience may be of little value unless it is put into practice. And that is what we're all about. Providing the knowledge to understand the mechanisms that are necessary to achieve global health and public health in countries, but also, and equally importantly, to put it into practice. And now I would like to turn it over. Well, I'll turn it over to you. I'll skip the career things since we're running out of time, right? We have too much time.
No, we have time.
We do have time.
Yeah.
All right.
It's just 20 minutes.
All right. So I was proceeding quickly because there's so much to cover. This master's in public health, we conceive as an opportunity for people doing graduate studies in India to attain the skills that are necessary, as I said, to bridge that no-do gap. And what are the career prospects when you graduate? If you have an MPH, who will hire you and where will you be hired? Here are some examples of career prospects for MPH graduates. Certainly, government and public service are employers of people trained in public health. Jobs in the public health sector at the local, state, national, and international levels, in hospitals, health administration, preventive services, the National Health Mission, Ayushman Bharat, National Health, Mental Health Program. All of these employers take people with degrees in public health. Also do primary health centers and community health centers. And internationally, agencies like the United Nations High Commissioner for Refugees, the World Health Organization, the High Commissioner for Human Rights, the World Food Program of the Food and Agricultural Organization, the Office for the Coordination of Humanitarian Affairs, the World Bank, the Global Fund to Fight AIDS, Tuberculosis, and Malaria. All of these institutions, governmental and intergovernmental institutions, need people trained with a master's in public health. In addition to these government and public service institutions, not-for-profit and non-governmental organizations, Doctors of the World, Child Care International, Global Alliance on Chronic Diseases, Rural Healthcare Foundation, all of these institutions are non-governmental organizations that are often big with multi-million-dollar budgets that need to hire people trained in public health. Similarly, foundations like the Public Health Foundation of India, AfriCare, the Bill and Melinda Gates Foundation, the UN Foundation, the Wellcome Trust, all of these institutions also fund activities that achieve health outcomes, and they need people trained in public health to guide those funding opportunities. And other institutions, other potential employers you may not have thought about are scientific organizations, the Coalition on Epidemic Preparedness Innovations, the Consortium of Universities for Global Health, the Society for Infectious Diseases. These are all scientific organizations, Planetary Health Alliance, that draw upon people trained in public health so that they can pursue their scientific research and promote scientific research on the subject areas that are of concern to them. Public health education, of course. MPH graduates can go on to teach in this subject area, engage in research and data analysis, conduct field studies, and so on. So public health education is another outlet for careers. And of course, a giant employer of people trained in public health is the private sector, with opportunities to either function as a consultant or on contract, or to be employed by insurance, the pharmaceutical industry, other companies that for-profit companies that need people trained in public health. And public health consultants can navigate between these various employers as they pursue their careers utilizing their MPH. And among the many career titles that people have who have been trained, they can either become public health nurses, public health physicians, occupational health and safety professionals, nutritionists, social workers, epidemiologists, even restaurant inspectors, first responders. These are all professional fields in which an MPH can land you the job that you would like in those respective fields. I mentioned the Lancet Citizens Commission, which is an excellent place to understand the challenges facing India that require people trained in public health to be able to make a difference. And the same thing is true of the Public Health Foundation of India, which engages Indian and international academic, state, central government, multi and bilateral agencies and civil society groups to address the capacity building in India so that India can achieve the ultimate objective, which is universal health coverage, so that every man, woman, and child can enjoy a fulfilling life consistent with the objectives of human development. Hence, our combination in this training in this master's in public health of public health skills with human development skills. And for those who are interested in it, I'd like to now turn the floor over to Vivekanand Jha, who will talk about the eligibility criteria and the admissions process. If you want to come in the next slide, we'll have the...
Thank you so much, Professor Marks, and thank you, ma'am. So those who are interested to apply for Masters in Public Health program, Professor Mark already explained in detail about the scope and opportunity. So I will deal with the admission process part. So those who are interested, they can go to the website of Jindal School of Public Health and Human Development or our JGU website. They can get the link from there and apply by filling the form and by uploading the required documents. The minimum criteria is the candidate should have a graduation degree from any stream, and even the final year student are also eligible to apply. Even final year student are also eligible to apply And after they fill out the form, they will be called for a faculty interview. Based on that, we will release a provisional offer letter, and there will be a certain time window for the student to pay the registration fee and secure their seat. And we also provide the scholarship on merit cum means, only on tuition fee, which ranges from 50% to 100%. There will be certain criteria and filters which we'll be using. For example, the candidate should have 60% marks in his or her graduation, the interview score which we will getting after the interview, and the parental income should be less than 30 lakh per annum. If you fulfill these three criteria, you will be eligible for scholarship from 50% to 100% only on tuition fee. And we don't provide any scholarship on residential fee. For any other queries and help and assistance, you can get my number from the website and from here also, and you can get in touch with me. I will be more than happy to assist you in admission process. Thanks very much. Please, Professor
And now
Mark.
we can exit the,
Okay, so probably we have few queries from students. If we can take up that. So I think we have a query from Dr. Bhushan, who wants to know a bit about healthcare in hospital and care.
I'm sorry, I didn't quite get the question. Healthcare and hospitals?
So he just want to know a bit about healthcare in hospital and care.
Well, hospitals function, it's a tertiary level of health. Primary health care obviously addresses the basic needs of families and individuals to be able to function in society with their basic health needs being met. Secondary healthcare in centers where treatment can be made of moderate injuries and illnesses. And then the hospitals are the tertiary healthcare where the highest level of health treatment and of injury and diseases can be addressed. The problem, of course, with tertiary healthcare is the cost. And where there is a fully functioning national health system, people with a need, significant need for treatment, are treated in the hospital at little or no cost. In countries like India or the United States, unless you've got an adequate insurance policy, the costs of being treated in the hospital can lead to financial ruin. So now, hospitals nevertheless provide the highest level of care in treating the most harmful conditions that can threaten a person's life. Now, I don't know what else was behind that question, but this brief reflection on the cost of hospital care and the fact that the hospitals are normally reserved for the extreme need of persons, as we saw with people suffering from COVID at an advanced level and needed urgent treatment. And of course, the hospitals proved that as the disease was spiking to be inadequate to the need, and hospitals failed to do their job. How do you prepare them? What are the decisions that can be made at the national, local, and regional level so that we don't encounter this problem the next time we have a spike in a pandemic disease like COVID-19? But the question might have had a different motivation, and I missed the point. I apologize if I did.
Right. Thank you, sir, for that answer. Okay, we're getting few more queries. The other query that we could see here is future scope for this particular course. What exactly career prospects lies ahead if they are, doing bachelor's and then going for master's in public health? So what exactly is the future scope, and is it something that they need to pursue in abroad, or in India they have ample of opportunities?
Well, once one has achieved the degree of MPH, one can either pursue more advanced studies, a doctorate in public health, a medical degree, other specializations that one might want if the graduate with the MPH felt the need for more in-depth education. There are also, and it's the case of most people who acquire this degree, they will have acquired an opportunity in the course of taking the MPH of internships, including foreign placements in different parts of the world, to see from the inside what the job prospects are like, and then to take on a job. It is certainly an adequate degree for that long list of career prospects that I put on the screen a moment ago in public health. So I guess the basic answer to that question are, yes, there are opportunities for further training and education for those MPH graduates who want to go into greater depth on a topic. However, in most cases, they're immediately qualified to apply for jobs in that wide range of government, intergovernmental, public, private, scientific organizations that need to employ people with degrees in public health. I don't know if you have any further points you'd want to.
No, I
share
agree
that?
with Professor Mark, and we are also in the process, to find out any university, the university across the globe which deals in the area of public health. Last Tuesday, we are meeting with our international office. So they are creating a list of the university who deals particularly in the area of public health in Europe, US, and UK. So by the time the session would start, we'll have a clear-cut list about all the name of the university with the eligibility criteria, and if someone wanted to go for semester exchange, dual degree, and everything. So all details will be ready, and we have a separate international office who deals and looks after all this. So those who willing to go and interested in the same, we will connecting the potential candidate with the international office, and from there they will take it forward. And whatever support will be required from our dean and the department, they will be receiving.
All right.
Yeah.
So there's another question from another student, and they want to know, can they practice privately after doing MPH? I mean, can they have private clinical practice after doing MPH?
Well, if it's a clinical practice to practice medicine, they need to be licensed to practice medicine. So now there are, so it really depends on the professional training. You have to be licensed if you're going to practice as a physician or as a nurse. You need to have a license to do so. The MPH gives you the background to integrate into an organization with whatever skills and licenses you have. So you can, the MPH can provide you with a more exciting career as a nurse or a physician. But the credentials necessary to be able to practice as a nurse or a physician are separate in addition. And in fact, the traditional MPH has been for people who already have their nurses or medical degree, typically. So one career path, therefore, is to draw on your professional qualifications, add to it the knowledge of public health, and have a much more exciting and enriching career as a doctor or a nurse. The other one is to draw upon your other background and training and your undergraduate degrees and other degrees you might have acquired, acquire the skills for the MPH, and then you can exercise a higher level of responsibility in various agencies and organizations that seek to improve the health system and contribute to the various building blocks of the health system or of global health. So I don't know, anything you want to add on that? No.
Okay, thank you for that answer. Another question that I could see is about the kind of compensation they can expect after completing this course. So
Yeah,
what kind
so
of
I would like to give
compensation they can
answer.
expect? Yeah.
So it depends upon the nature of the organization and the role at which you are being hired. For example, one of my colleague who did just public health specialization like me for a year, and he got placed with NHRC, which is the wing of Ministry of Health and Family Welfare, Government of India. So currently he is receiving around 70,000 per month. So he is a public health consultant. So it depends upon the nature of work and the level at which you are being hired and the nature of the organization. For example, if you are being hired with UN agency, then definitely your pay scale will be different. And if you are being hired at the national level, your pay scale will be different. So it is entirely different also. So my point was, you will be doing 2 years purely masters in public health. So you can imagine if someone is getting 70,000 per month after doing public health specialization for a year. So you people will be doing going to the job market after 2 years. So definitely your pay scale would be higher. For example, Niti hire a young professional, public health specialist, health consultant. So it differs. For someone you will getting 80,000, someone getting 90,000. So it is entirely different and differ from organization to organization. You have something to add?
No, I think that's
Right.
Yes.
Talking about the eligibility criteria, someone who will be sitting for this exam, what's the minimum criteria that is required? What kind of bachelor's degree is required if they have to, pursue a master's degree? Or, it's preferable to have a bachelor's degree in science or medicine and then probably choose this in the master's.
So with due
Yeah,
permission, I will.
please.
So today only, we had a student from BBA background, and Professor Mark also met her along with her family in the office. It is not mandatory that anyone should have from medical background or science background or economics background. Anyone, those who have a relevant degree, a graduation degree from any stream, will be eligible for this program. So current batch, like the enrolled student have someone is a physiotherapy, someone is MBBS doctor, someone is from BBA background, someone is from sociology background. So it is diverse background. It is not mandatory that you should have background only in medical related things, then only you will be eligible for MPH and you will advantage and disadvantage. Nothing like that. The course structure is balanced in such a way that everyone will get the equal attention and equal what I should say exposure and experience during the course and after graduating from MPH.
Right. Thank you for that answer. We have another question regarding the interviews. So the students are also interested to know how can they prepare for interviews?
So since I am handling the admission, and with your permission, I would like to tell. So whatever document they are uploading, for example, they are uploading the mark sheet from first to fifth semester or sixth semester degree. They need to aware about what they have done in their graduation. Second thing will be they will be required to upload an SOP, which is mandatory. So whatever they have written in the SOP, they need to be thorough about the SOP. They cannot do hide and seek with the SOP. So whatever information is given in SOP, they need to be thorough and be clear. And if we have someone have work experience, they can talk about their work experience, their internship, and how they are related to masters in public health. So they need to convince the faculty who will be taking the interview. Of course, we cannot dictate the faculty like in the way in which he or she take the interview. So it is entirely depend upon the faculty how they wanted to take, in which way they wanted to take. Certain things which I have listed, for example, their motivation will be tested, their communication and analytical skills will be tested. If they have some work experience, for example, we have few MBBS doctor, and they were working with some of the organization as a consultant and other things. So they explain their work experience and they connected with their MPH degree, and then SOP and their motivation to do MPH. So it will be more or less in general and overall about public health.
Thank you for that. We got few questions during the registration process where students were asking about who are the top recruiters for this course. I mean, after they have done with the course, who are the top recruiters who go in, for postgraduates from this course?
By top recruiters, you mean what is
The employers probably who will be,
who gets
looking
hired
for.
where?
Yeah.
And of course, this is the first batch. So one of the things that you learn in public health is to be evidence-based. And the number of students who have sought jobs after this degree is zero because we haven't started yet. So the point is, we expect in a few years to be able to provide a list of who are the employers, how did everybody get it. One of the things that I have noticed as I look across the schools at this university is that the university takes great pride in the other schools in enumerating the employers that have hired the graduates. And so there are many examples in the law school, business school, School of International Affairs, and so on, where you have a pretty impressive list of the employers. And I can tell you, speaking personally, that I fully expect that to happen with respect to this MPH program.
And we do have Office of Career Service who looks after internships and placement for respective schools. For example, the organization and form which comes for public policy school, they can also hire MPH candidate. For example, we had UNICEF, we had WaterAid, and we had UNDP, then Niti Aayog, then say IIT, different IITs, and then the UNICEF, UNESCO, PwC, EY. So they have different the separate government and advisory wing in which they have, so they give more importance to the social sector. So yeah, we do have the placement cell who will help the student to secure internships and placement, and it also depend on the student, how they prove in the final round of the interview, which the potential organization and the potential candidate will be taking.
Right. Also, if you would like to tell them about the exams they would have to sit for, to appear for this course. So what all exams they need to
So
clear?
we don't have any exam. So after uploading all the required document along with the SOP and mark sheet, the admission committee will assess the applicant suitability. Based on that, they will be called for the interview, faculty interview.
Okay, so is it offline or online, the mode of interview?
Completely online. Everything will be completely online. The classes will be offline, of course, on campus from 12th of September. The classes will be physical, but interview and all other mode of communication will be online only. And of course, if someone, sorry to interrupt you, and if someone wanted to see the campus for the campus visit, they are most welcome to come from Monday to Sunday, 10 to 5 p.m.
Okay, so they are also asking, is this the first batch from Jindal? So I think this would be the first batch.
This is the first batch, and we have a great pleasure. The school is being led by Professor Stephen Marks, who does not require any introduction in the area of public health when we take his name. And I believe that the first batch always have great pleasure, great advantage to explore, to experience on a lot of things. The first batch is always special, and Professor Mark, giving special attention to each and everything which is being done for this school.
We look forward with a lot of enthusiasm to this first batch. I sincerely mean that, where this is going to be a wonderful adventure. We know the skills that need to be acquired, we can provide the courses, but having the excitement of being among the first ones to achieve this MPH will be, I think, an event to be remembered.
And the candidate will have advantage to study the cross elective from 11 different schools apart from our own JSPH. So they have advantage to study international affairs. If suppose someone wanted to understand about the international policies on and how they affect the health policy, for example, WHO, UNDP, and any other multinational organization, so they can take the elective from international affairs. If someone wanted to look from policy angle, So they can take the elective from public policy school if someone have
Health
interested
economics.
in economics, and if someone wanted to look into the law angle, for example, they can take the elective from law school. And we have a professor, like Professor Deepika Jain, who run the center and who works in the area of health and technology, which is very much in demand nowadays, especially after COVID-19.
Yes, that's a very important area that we can rely upon our colleagues from the other schools to.
And we have the best mind in faculty from across the globe, not only from India. And Professor Mark would agree with me. And they have worked with many state government, central government, in fact, many international government also. So I had an opportunity, to design a proposal on universal health coverage, in which Imperial College London, Mexico, Brazil, and India was a partner. And one of the faculty from JGU, who is the expert in area of public health and health economics, healthcare system, was one of the PI, for that project. So student will have also opportunity to explore that kind of opportunity when they are doing MPH here.
Right. So before we move to last few questions, Dr. Bhushan, I will take your question after this. Don't worry. I'm just launching a poll for all of you who have been, part of this webinar as of now. And I think a lot of queries got answered here. And this is something very new MPH course. I don't think we have a lot of videos on this or counseling sessions on these. And we tried to get a lot of answers to this new course. Of course, it's our first batch at Jindal. So a lot of you seems to be interested in this course and taking up this course ahead. For sure, all the assistance will be provided to you. I've already started sharing the page link for this particular college from Shiksha. So you can always reach out to Jindals for this session. And I think Mr. Jha has already explained entire thing, the entire admission process. How can you, put in your process and get selected and move ahead with taking up this course. So if you have liked this session, I would request all of you to kindly fill up this feedback poll and rate us. And if you would like to recommend these webinars to your colleagues and friends, so I would request all of you to please rate us out of 1 to 10. How much did you like this session? And if there is anything, you can quickly share your query here in the chat before we move towards the conclusion of this session, right? So meanwhile, they're filling up the form. We are getting another question from Dr. Bhushan, who wants to know, can we do ayurvedic practice after completing MPH?
Well, certainly, Ayurvedic practice is one of the great contributions of India to global health. And the role, I think, of an advanced degree in public health would be to help the future practitioners of public health know how best to balance what's called biomedical model with the more indigenous models of health-seeking behaviors and of medicines and all the rest. There's a lot of wisdom to be gained from Ayurvedic medicine. And obviously, a professionally trained person with an MPH should also know where certain practices might be harmful, other practices would be helpful, and to find the best way, given the social, historical context of the community you're working with, of how best to achieve health outcomes, drawing upon various traditions of health practice. And Ayurvedic medicine is certainly part of it. We do intend to include in the teaching some opportunity to understand how to balance these issues, but certainly the practice of Ayurvedic medicine would be a valuable way to put into practice what one has learned in getting an MPH.
Right. So I think, Dr. Bhushan, your question gets answered here. So I hope that clears your confusion, right? So we'll just quickly pick up another question from Preeti. and she's interested in doing Masters of Food and Nutrition and PhD pursuing in food technology. So, after completing this field, what exactly the scope is there? What scope she can see in that?
So obviously she can, after doing MPH, obviously she can choose a one, one of the aspect of public health. Public is a very big, say big branch, and she can pick up, for example, I am interested in the healthcare finance and healthcare governance. So my aim is to do PhD in the same aspect of the public health. So broader area will be public health. Under that, she can choose a branch. For example, she can be a nutrition specialist. She can do the PhD in food and nutrition. So obviously, the MPH will help her to build a holistic approach of the public health to look from different angles. For example, what is the advantage of do the data analysis in public health? What are the the quantitative and quality aspect of public health, governance aspect of public health, finance aspect of public health, food and nutrition, which is the one of the critical aspect. These two are the critical aspect of public health, and she can assess about IMR and all these things across the global India. So this MPH will help her to build the overall perspective about the health system, not only in India and abroad also. Then she can choose a particular field about, for example, she's interested in food and nutrition. Of course, she can go ahead and write her thesis and do the PhD in the same field. And this MPH course will be very much helpful, while she will pursuing her PhD degree.
Right.
Everybody taking the MPH will be exposed to food and nutrition as a subject area of public health. And those who want to go farther than that will have the opportunity, both through internships and more advanced degrees, to become specialists in food and nutrition, food security and nutritional issues. Yeah.
Right. So I think that very well answers their queries. Okay, quickly taking up the last question from Sanjeev. Okay. So he's asking, is there any option to attend online class other than on campus at Jindal's, and also the fee structure?
So as of now, we don't have any, online classes. The classes will be offline, and as per the government directive, the classes for MPH cannot be online at all. So it will completely offline. And regarding the fee structure, the tuition fee, which course fee is 2,50,000 per annum, and the hostel fee is 2,76,000 per annum. As I mentioned, while I was explaining about the eligibility criteria, so we do provide, JGU as a university, which is a non-profit profit for promoting public services. We do understand the importance of public health, and which we have faced during the last 2.5 years, still facing. Apart from COVID, we have other health challenges, which is there in our country. So by considering all these aspects and being a responsible university and a global university and #1 university in India, we do provide the financial assistance to the student from 50% to 100% only on tuition fee. So we don't want anyone should miss the chance just because they don't have any financial assistance. So it is a small token of appreciation toward the nation building and society, which we are trying to do. So we do provide scholarship from 50% to 100% only on tuition fee.
Right. Thank you, sir. I think that very well answers, and I could see the feedback coming in also. So I'm glad that, all your queries are resolved here. But if there is anything else, you can always drop us an email and probably we can get back to you. Or if you need any assistance for Jindal's, you can always reach out to the university or probably drop a mail and we can connect you with Jindal University. So you like to add something?
You can mention my email address in the chat box. So and I already given my phone number and everything. So if someone have any query, they can always write back to me, and very much available on phone and email.
Yes,
so
absolutely.
I'm more than happy to assist them.
Absolutely. I'm sure if there is anything, we can definitely help them reach out to the university and they can connect with you and, take the process ahead. And, if they have to ask anything or is there anything that they want to know regarding the course and the process and the admissions, they can definitely connect back and get hold of all the answers. Or you can just drop us an email and probably we can help you out with all the details. And this video will be uploaded on YouTube. So you can always go back to the video and get all the information that I think Stephen sir did share, in the starting of the session, the entire, a lot of them have queried about the entire process, like what exactly MPH is. So I think sir has brilliantly explained through that presentation. So you can always go back and have a look on the presentation and well explain why you need to do and what all the scopes are in India and abroad. So everything is like very well explained out here, right? So I think that works for all of you. And thank you so much, Stephen sir, for being part of the webinar. Mr. Jha, thank you so much for,
Thank
giving
you.
out
It
all
was a
the
great pleasure.
details.
And I look forward to welcoming some of the people attending
Absolutely.
as first batch, part of the first batch.
Absolutely, absolutely. And thank you to all the students for being part of this session. And I hope the session was useful and informative to all of you. And of course, we'll be having more such webinars in the coming days ahead. I'm sure all of you are following us on LinkedIn and Instagram and Facebook and on all social media handles. So just keep a check on our social media handles. We'll be coming up with more such sessions, more such counseling webinars. And thank you so much for being part over here, and have a great evening to all of you.
Thank you so much.
Thank you very much.
Thank you.
Don't forget to like, share and subscribe our YouTube channel.